I'm not the house of cards that falls down easily. I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Sunanta Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Hi, everyone. We are doing a show on our First Responder Mental Health Network with my co-host, Barry Toon. Hi, Barry.
Hi, Kristin. Good to be with you again.
Yeah, absolutely. And we also have special guest, Prairie Conlon. Hi, Prairie.
Hey, how are you doing today?
Pretty good, pretty good. I wanted to follow up with you because we just did the show about when animals attack, which Barry knows nothing about. Well, I'll tell him in a second. But on the show, you had mentioned accelerated resolution therapy, and I had not heard of it. I'm so excited about it, and because of that show, we've had so many people call in and email and direct message me asking, what was that? Where do I find that? What does it do? So that's why I wanted to do this follow-up show with you so we could talk more about it.
Absolutely. And I'm so excited that people have been reaching out because this therapy is incredibly powerful. It's one of those that there's results soon. Usually in 1 to 2 sessions, we can address certain things. Of course, other things pop up, but we'll get into that. It's one of those things too just as a therapist, I am so excited to have that tool in my toolbox. It's amazing.
Yeah, exactly. I'll get into some of the questions. I've got a small list of questions I kind of compiled. People kind of asked the same questions, and we'll get into that in just a minute. But first, I wanted to talk to Barry about something you and Prairie and I were all talking about before we hit, the record button, about what we're seeing going on out there in the world in general, but also in the first responder scene in terms of uptick in businesses or awareness or, just kind of how we're seeing things change and shift in the world as we do our work working with or as first responders. So Barry, can you share with us, with the listeners, what we were talking about?
Sure. We work, of course, with a lot of first responders and a lot of police departments, fire departments, and other agencies. And I've had a number of chiefs, one in particular just yesterday, reach out and talk about the dramatic increase, the uptick in domestic violence calls that his men and women are having to go respond to, and how that has affected their mental well-being. A lot of these officers are already dealing with some generalized anxiety because they're having to go into environments where, for the very first time, you're not so much aware of external threats, weapons, things like that. You're dealing with something microscopic, getting sick because of the virus.
Right.
But on top of that, there's an increase in the kinds of calls they're having that are a direct result of people staying at home, living on top of each other, being under tremendous amounts of financial stress. So they're not only getting a lot more of these domestic violence calls, but the nature of those calls are much worse, at least from the reporting that we're getting, than they typically are, and it has separate and apart from what that means for the victims of those domestic violence calls. I'm focusing on just what's happening with the officers, but that has placed tremendous strain on them. So it was just really, really interesting listening to some of the feedback we've been getting on that.
Yeah, I bet. And I know, Prairie, you were saying too that you're having an uptick in number of patients, and also the since you're a psychotherapist, and also, is it psychotherapist, counselor, psychologist?
Yeah, psychotherapist,
Okay,
therapist, counselor, that works.
Okay,
But so this is actually, it's actually really interesting, Kristin. So I actually was just speaking about this, is that at the very beginning of the pandemic, which, I mean, it feels like ages ago now, but I know it's only been about, like a month since that, kind of we started all realizing this is going to be big. This is going to impact all of us. So right there at the beginning, and for maybe the next week, and even the second week into it, was there was an uptick. There was a big uptick, and people wanted to, talk and kind of process everything. But then what I've noticed in the last few weeks is that it's actually been decreasing quite a bit. And my personal theory on this is, when you look at Maslow's hierarchy of needs, right, at the very base level, we're worried about food and shelter and safety. And with the decrease in financials, with the decrease in the amount of jobs and, furloughs and everything like that going on, that's what people are focusing on. And the mental health stuff, if you look at Maslow's hierarchy, is up at the next few levels. And so because of everything that's been going on and the worry about, making sure to provide those basic needs, I've seen less clients just because financially they're wanting to make sure that they meet those basic needs.
Right. It's interesting. And there are many, many therapists that are doing as much as they can pro bono. But what's interesting is, I'm friends with so many therapists, and I don't know if this is all that interesting, but the reality is, they have to meet their financial needs as well. So I had a friend of mine who has been doing free services, but she can't continue to do that because she's got to eat. And she's the breadwinner in the family. And so she's getting some backlash for not continuing to provide services. She's actually going to go start working at a grocery store just to be able to, every website she goes to, because she's lived in 2 different states in the last few months, so she's not sure where her unemployment would kick in. And she's gone to both websites to try to sign up for unemployment. The sites are always down, which I'm not complaining at all. I'm just saying that's the reality that we're seeing. So even trying to get help, she can't do that. And she's getting a ton of, backlash about, well, I can't believe you're not continuing to give, free services. How horrible of you. And she's like, well, I have to go work because they're not going to forgive my mortgage. Her bank is not going to let her. She will go into foreclosure. I mean, just all of these trickle down effects that people don't tend to think about because we're all panicked. So we're not operating on calm, in a calm state anyway.
It is interesting when people's finances are so, their financial system might become so acute that it starts to dictate what they can and can't do. And you're right that where mental health fits into that, it's certainly not going to come before food and shelter. But I'm wondering what your thoughts are on what that's going to mean when the economy cycles back up and these urgent needs and crisis that we're experiencing resolves, as it inevitably will, that there's going to be a lot of trauma and a lot of things that haven't been dealt with because people weren't addressing the mental health needs that they had. And I'm wondering if you're going to anticipate a significant uptick in business again later on.
kind of back up and reframe how this looks. One population that I work with quite a bit is the military. I'm a military spouse. My husband got out of the military a few years ago. He did 11 years. And so a lot of my practice was always focused around, working around military bases. And what we would see was when these soldiers would go on a deployment, they would function well in the deployment. They would get done what they needed to get done, right? And there was no focus on the mental health at that moment because you just needed to get through that deployment. And there are so many parallels I'm seeing with this, this pandemic. It feels like a deployment in a personal way. For me, it feels like a deployment. There's kind of that uneasiness that every day you wake up, is everything going to be okay? What's happening? When is this going to be over? Because, in the military, they could extend your deployment at the last minute if they wanted to. And so in a personal way, it feels like a deployment. And then professionally, it's one of those things too, where I feel like we're going to see increased, mental health issues with people coming out of this. Just like a group of soldiers come back, they're more likely to have a population of, when people are going to come out of this, I feel like it's going to look very much like how it looks when a group of soldiers come home. I think that there's not everybody's going to have PTSD, but is everybody coming down from functioning at higher levels of anxiety than normal? Absolutely. How they deal with it is obviously going to be due to, resiliency factors, different things that they have going on, their own personal perception. But I think it's very much going to look like coming out of a deployment. You've been at a heightened level for a certain amount of time. You had that level of uncertainty. Is it going to be okay? Am I going to be the next one? And I feel like very much it's going to look a lot like that.
Agreed. I think things like it's the timing. And I think the reason why people jumped on that show we did, number one, I've never done a show like that in my life. But I think hearing about a new therapy that has maybe a faster retention rate than previous therapies is perfect timing to talk about. So let's get into talking about what ART is. And the first question that I got from like 40 people, the same question was, is it like a faster, quote unquote, version of EMDR? Yes.
That's a perfect way to put it. It's like EMDR on steroids. It uses bilateral eye movement stimulation, and it's an evidence-based cognitive program that it fosters the rapid recovery by reprogramming how our brain stores these traumatic memories. And so it just kind of helps you rewrite and redo in one session a specific feeling, because we have two different kinds of memories. We have sensory memories and we have verbally accessible memories, right? And verbally accessible memories are what we use to have a conversation, to recall words and to recall things we learned at school and memories. Now, sensory accessible memories are very different. Do you know when you're like driving along in a car and you hear a song and it just reminds you of something and it takes you right back? Mm-hmm. Or you smell something and you're like, oh man, that puts me right in this old memory. And it doesn't matter if the memory is good or bad. That recall is just bam, it's there. And that's where PTSD lives. That's where trauma lives. And so that's why it's a really hard thing to treat as well, because it's not something that it's just like you can just recall it. It's a feeling, and it's something that, can just bam out of nowhere hit you.
Right.
And we work on those sensory memories in accelerated resolution therapy. And yeah, it can actually, in as few as one session, we can address that.
So there'll be people that will be coming in and are coming in, because I'm hearing this from the other therapists that are on the network and my friends and so on, people with PTSD from what's happening right now.
Right. Yeah. And that's something that, yeah, absolutely accelerated resolution therapy can address that kind of, because when we talk about an emotion and you think, oh, I was scared. Okay, well, what does scared feel like in your body? And it feels different for everybody, right? But then we have them actually focus on that feeling. For example, let's say, oh, scared, I feel that in my chest. It feels like a tightness or a heaviness on my chest. And we focus on those sensory feelings and we process them out. And it's always one of the most amazing things for me as a therapist too, is, seeing results right away. I love at the end of the sessions, I always hear people say, I can't believe how relaxed I am. I cannot believe how much better I'm feeling. And that's something from years of doing traditional therapy services, animal assisted interventions, all these things that I love. Using that alongside ART for those sensory things that can come and just bite you at any time has just been incredible.
Hey listeners, a quick but important notice for all the shows that we'll be doing for our first responders. In 2018, the number of police officers, firefighters, EMTs, and veterans, anyone who's considered a first responder, who died of suicide was greater than the combined total killed in the line of duty. More attention is being paid, but help is often elusive. Even with more available resources, those who are first in line to help us actually asking for help for themselves, that can be the hardest thing for them to do. Mental Health News Radio Network is working with StepStone Connect to give voice to our incredible first responders. StepStone Connect is an organization born of the belief that accessibility and confidentiality will eliminate traditional barriers to treatment. Privacy and the peace of mind that comes with it, combined with easy, everywhere access, underlines StepStone's mission and treatment philosophy. It's simple. With access to the internet and a device with a camera, you're a click away from leading mental health clinicians who specialize in the treatment of PTSD and other trauma-related injuries for first responders and their families. If you or someone you care about is struggling, please don't let another day pass before discovering what StepStone can do. Stronger connections, everywhere access, StepStoneConnect.com. You can find out more by going to their website, StepStoneConnect.com, or call 800-495-3761. Now back to the show.
When did this start to get out there and become more popular? And I know it's definitely being used in the military, correct?
Right. So this, in comparison to other therapeutic modalities, this is a baby. It was started in 2008 by Laney, and she's probably going to go, oh my goodness, you butchered my last name. It's Rosenzweig, I believe. And that's probably not right. So sorry, Laney. But it was started in 2008 by Laney. She's an amazing person, just incredibly intuitive into this kind of thing. And she was using EMDR. And she said that she felt like there was a way to maybe resolve it a little quicker, to kind of bring it home and to actually get to that place of resolution. And that's how she started developing it. Since then, there have been 3 clinical trials. There's been 10 papers published by different researchers. And in 2015, ART was recognized as an evidence-based therapy by a National Registry of Evidence-Based Programs and Practices. So that was kind of a big deal. As therapists, we've seen it work, but then to have it recognized like that was pretty awesome.
Absolutely. And how is it being, utilized, or I was going to say deployed, and then thinking, oh, but that could be a pun. How is it being utilized in the military?
So right now, it's not something, again, it's just only 12 years old, but we, as a lot of private practice therapists, that's what we use. You have to be trained in it. It is something that you need to go to a training. It's a pretty intensive 3-day, full 8 to 10 hour days of learning. But once you get certified in that, then you can practice it. And that's kind of the blocker right now, getting this out to everybody is, like many therapists, well, all therapists are, trained in traditional psychotherapeutic techniques. This is a different modality. This is something that you have to be trained in before you can do, because it is very powerful. It can, think about that, when you see somebody in a flashback, we're actually maybe taking people there. And so it's pretty powerful. And that's why you need that special training. So it is, I know a lot of therapists, that's the reasoning. That was my reasoning for getting trained in it, but it's not everywhere. It's not being used extensively in the VA. The therapists there aren't all trained in it, because it is something that they would have to pay for, but it is something that we are pushing to get people in the VA trained for it. And, I'm hoping that there will be success in that, because the thing is, the military, as a military spouse, I learned that what the military is looking for is to make sure that you're ready to go. Right. And you're ready to go as fast as you can be, right? I mean, they don't want to spend a lot of time or money they want to, that's what the Army is though. And I'm not saying that in a negative way. We want the Army to be ready. So, readiness for deployment, readiness for doing what you need to do. And so I'm hoping that, with, as more studies come along, that accelerated resolution therapy becomes the norm for the VA, because it is something that's going to be able to get your people there quickly and get them there in a really healthy, non-invasive, non-pharmaceutical way.
Gotcha. So right now it's being used by therapists that treat veterans and active duty, and it's kind of doing that sort of grassroots movement that way, knocking on the door of decision makers in the military as, hey, you need to take this more seriously.
Right. Mm-hmm.
Awesome. Go ahead.
Prairie, I have a question for listeners who are familiar with EMDR. Explain a little bit what the mechanics of ART are. I understand some will be familiar with EMDR. They know that this has something that's accomplished through the use of rapid eye movements. But for those who aren't familiar, people like me, dumb it down so that they can better understand what the process is like. If they were coming in to see you to have an ART session, what could they expect?
Right. So, if they knew what EMDR was, I would say, look, it's EMDR. That is a little quicker. If they didn't know what EMDR was, I would explain to them, we're going to talk about your trauma. I would explain again kind of how I talked about the verbally accessible memories versus the sensory accessible memories. We're working on those sensory accessible memories. And I let them know it feels a little weird at first, but it's an eye movement therapy. So I'm going to be sitting relatively close. Now, Laney recently, due to kind of everything with the pandemic, with, not social distancing, has been working on a different way where you're actually farther back and you're not using your hand. Normally, we are usually a couple feet away from a client and we move our hand back and forth while they keep their heads straight and make sure that we are getting that eye movement completely from side to side to ensure that they're getting that stimulation. We are now kind of looking at different ways to modify that, obviously because of social distancing and stuff like that. And so they're using a wand a little bit further back. But that's basically what I would say. I don't like to get too much into it about all of the fun scientific stuff because as my husband has told me, I can get really excited about that. And he's like, I lost you a long time ago, but you were so excited. So I just decided, I let him know, look, this is something we're going to access the sensory memories. I'm going to move my hand in front of your face. Your eyes are going to go back and forth, and we're going to address those sensory memories.
Absolutely. Yeah, that's exactly where I was hoping to go. So that's perfect.
Awesome. Okay, so we'll start from here. So Prairie, because things have changed and every therapist I know, is doing therapy through telehealth, which is fantastic. I've been beating the drum about telehealth for years. and talking about it in different electronic health records platforms and championing the ones that, did a good job of putting it, in there into their EHRs. And now all of a sudden everybody's telehealth, which is great. So how, is this kind of therapy something that you can do through, I know you can do it through telehealth services, but is it just as, I know this sounds like a fundamental question, but this is one of the other questions that was asked, is it going to work as good, quote unquote, if we do it through telehealth as if we did it in person?
So I think there's always that caveat that, it works better when you're in person. And in fact, up until, kind of this pandemic, accelerated resolution therapy was something that we would hardly ever consider doing with teletherapy, because again, this is trauma work. And this is something that's a really powerful form of therapy where it can bring you right back into that situation. It can almost make those feelings feel as if you were there right away. And so we have to take some extra precautions with accelerated resolution therapy. Again, they're not endorsing to do it that way, but I know a lot of therapists are making accommodations. So I recently developed a training if you're using any kind of eye movement therapies online. If you're a clinician and listening to this and using any of that, I actually have a training that's available. I made it for free so that you can, look into all of the different things, because you need to be very careful screening for online therapy, period. Whether you're using eye movement therapies or anything, if you have somebody that's got some major trauma, or they're in an unsafe situation at their home, you definitely don't want to be doing the online counseling. But yeah, this is something, and there's been different ways that people are using it. But one of the biggest things that's important with eye movement therapies is having an assistant there at the house with them, somebody that's going to sit like in the room with them, or, just directly outside of the room if they're a little uncomfortable with talking about what they need to talk about. But that's a really important piece of it, because, again, trauma work, it can be intense. And so we want to make sure that they're safe and there's no way that they can hurt themselves. But there's a whole process we go through. I developed a training for that I'm giving out to clinicians, and definitely. But I think a lot of therapeutic modalities are kind of looking at ways to adjust to
this new world,
this new social distancing and the pandemic. Mm-hmm.
Absolutely. Because it's not like this is going to, even though they say, okay, we're going to lift restrictions and so on, nothing's going back to the way that it was. It's just not going to. We've got people working from home. We have people doing therapy from home. And I'm already hearing things, from psychiatrists or psychologists and psychotherapists, like, that just really were like, I will never do anything online. Forget it. It's not going to happen. And now that they're doing it, they're going, oh my gosh, this is great. It does work. And I can, do more in some ways. So it's not like when restrictions get lifted, everyone's going to stampede into people's offices and so on. These tools that are being developed to do things online, even with school, are going to stick around. So just, for listeners out there, it's business is booming for the online world, and not in a way that we would have wanted it to get to a place where it's booming, especially this way, but it's not going to go away as soon as, we can stop social isolation.
Yeah, I think there's just going to be a whole new recognition of telehealth in general. It's something that, a lot of times whenever I would explain my job, I've had more than not people say, oh, you can do that. I didn't know that. And the thing is, now you turn on the news and you're going to hear telehealth, telemedicine, teletherapy. So it's just going to be one of those things, I think, that's going to become a new normal. It's not only the convenience and the affordability, but just, I think, people are going to know what it is now.
Yeah, absolutely. And Barry, that brings me back to you to close us out on the show. Your whole organization, StepStone Connect, is telehealth services. So how are you guys handling the influx? I know you primarily, you work with everyone, but also a big focus on first responders. How are you guys, handling this, influx of interest and business that's coming your way because of COVID-19?
Well, we've been doing this for a few years, and so we were well positioned to handle this. I do echo a couple of things that both of you have said, and that is when we first got into this space, we did get a lot of pushback from the traditional parts of the industry. As time's gone on, I think there's been a general acceptance, and there's been a number of studies testing the efficacy of telehealth. But it is interesting that once people get into the space and they try it, they do realize that it works. Prairie, I'm fascinated with this, and I was so excited to hear from you today. I have some clinicians that work for us that are very well trained in EMDR, and were very skeptical a few years ago about whether or not that would be something that would translate well online. And now they swear by it. And a lot of it had to do with people developing the right software programs and the right, some things that had to be looked at before they could be comfortable with it. So I'm really eager to see how this plays out in the telehealth world. I honestly think it'll be successful, but that's something that you would know a lot more about. We've been busy, Kristin.
I'm sure.
As you can imagine.
I told my
incredibly busy.
Yeah, I told my assistant, I don't know if we'll be able to get Barry on, but let's try.
Well, we talked about the need for therapists right now, and the need for clinicians to work with first responders has never been higher.
Oh,
and
yeah.
I probably need some help from Prairie, because I have a hard time saying no. And so we're taking a lot of folks from departments and saying we'll work out the math later. But we are busy, and there's still a lot of generalized anxiety out there. And I'm grateful that we have a tool to be able to help folks.
Absolutely. Well, I want to thank you both for coming on this show, this impromptu show. And Prairie, can you tell our listeners where they can find out more information about you?
Yeah, so I have, my Facebook business page is just Prairie Conlon, CONLON, and that's where I also have access to that free course. And then just for some supplemental help as well, the company that I work through, thrivetalk.com right now, we've got some free sessions just for healthcare workers and first responders. We've got some therapists that volunteered. And so, if they're needing any additional help, we could definitely help out that way as well.
Awesome. All right. Well, thank you both. And listeners, thank you for tuning in to another episode of Mental Health News Radio. Hey, everyone. I just wanted to make sure you know what website to go to. It's artherapyinternational.org. So artherapyinternational.org, or you can Google accelerated resolution therapy, and that will pull up a site as well. It's really important that all of our counselors out there, anyone in the mental health field that's providing those kind of services, know about this form of therapy and know how to get trained in it. So please remember that site, artherapyinternational.org, or Google accelerated resolution therapy. Thanks so much.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial.